Hello from Belgrade. We are sitting at the Signature Cafe at the park with famous dermatologist Dr. Gorana Isailovic, famous for her work in wellness, author of 2 books, Wellness in Serbia, first Guide to Wellness and then Wellness to Serbia, and later one of the founders of forest medicine in Serbia. So now we'll start our interview. So Gorana, please tell us something more about your latest workshop.
I will present on International Forest Therapy Days a workshop with the name subject mental well-being and health tourism and wellness program based on forest medicine.
Okay, so this will be presented at the Finland, or
it will be presented from Parkono. It should be a workshop, a live workshop, but due to COVID pandemic, we have to make it online, and I would like to say hello to all audience who will look our workshop.
Okay, so tell me, when did you start this work, your preparations for this event?
I am president of Medical Spa Association of Serbia, and with our team we have a goal to make research and development in the field of wellness and health tourism. So our focus was on mental well-being in the time of pandemic.
Okay, so you worked during quarantine time when people were locked for almost 2 months.
During the quarantine, I have my several tasks. One of my tasks was to check my patient, dermatology patient. So I was doing it using the mobile teledermatocosmetic platform. So I check more than 120 patients online.
Wow.
And
so sorry, they were sending you pictures by phone, or
they were sending me pictures. So we also have a live checking by using Skype or Viber. So I have my patient from almost all over the world, and my other task was to work with my students. We have our electronic classroom, and using our electronic classroom we
sorry, we didn't mention that you are professor at university, at Belgrade University. What is your specialty?
I am dermatologist, but funny, I am teaching my student medical spa therapist and well-being therapist, several subjects. My main subject is wellness programs, and the other subject is new trends in medical wellness and health tourism.
Okay, so let's go back to your project during COVID-19 lockup.
We have some kind of study that all of my students had to do to catch their points for Bologna study style. So we decided to measure mental well-being of all of our students using some kind of measuring tool with Manchester color wheel method, with the Warwick Edinburgh mental well-being scale, short scale, with 7 questions, and with some kind of workshop called mandala-like drawing. They are making mandala to express their feelings in the moment of pandemic and after some procedures that we created for all attendants.
Okay, so you measured it only once, or you have two checking points? How did it work?
We measured it after sitting in the quarantine, and the second measure was after prescription of nature. So they made their own prescription of nature, or RX nature. It can be performed in the real nature or in the virtual nature.
Sorry, during the lockup, people in towns were not able to go out, and only people who have houses were able to go to nature,
yes.
Right?
Half of my patients has their home in the village or in the suburbs where they can go to the real nature, but half of them have been locked in the city.
So how they made any contact with nature?
I asked them to find some virtual pictures from nature, some sounds, some landscapes, some stories, and they were searching through internet for the nature, for the pictures of nature and sounds of nature and sketches from nature, and they perform a short video, and that video they send to their friends and their family, and after 2 hours searching and creating the video, they measure their mental well-being again using the same method.
So did you discover any differences between these two groups? People who went really to nature and people who just online enjoyed some videos?
What was really exciting was for me that even those students who didn't enjoy real nature, but just virtual nature, has the measurable improvement in mental benefit, little bit less than real nature, but the improvement of mental well-being was significant.
Oh, that's very interesting. So tell me more. What did you do after these measurements in your project?
After these measurements, we have idea for health tourism people and for well-being people that they can perform some kind of nice landscape, some kind of picture from nature, from hotels, from spas, from mineral spas, and that picture will mean a lot for their customers. So they will feel better, and they will became more connected with the nature and the touristic programs after the lockdown was cut. When we are speaking about quality of life, we have to take our attention on several qualities of life. To live quality of life, it is not just to have a healthy body, but you have to be in balance with your emotions, with your intellectual part, with your social part, with your creativity, with your ecology, and spirituality. If you don't have any of those dimensions, you will not live your quality life, and you will not be happy, and you will not be healthy. So that is a circle of well-being.
So Gorana, you're a medical doctor, but very involved in wellness industry. How does that happen?
It is very interesting. I was once at some lecture performed by a Japanese professor, and he showed to me that that health is indeed happiness. Because if you are happy, your pro-inflammatory cytokines will be low. If you are not happy, your pro-inflammatory cytokines are high. So if you are happy, you will be healthy. If you are not happy, you will be sad.
So you consider happiness as a major precondition for health and well-being?
Yes, and when I start looking through that spectacles, I discovered that if you want to be happy and healthy, you have to live some kind of quality life, and quality life can be measured by several dimensions. It is not just to have a healthy body.
Please tell us something. How do you implement all of this in concrete wellness programs?
Every wellness program and health tourism program have to fulfill some very important tasks. The first of all, it should fulfill perfectionism of service. So you will have to get more than you expected. And when we want to do it, we should have individual approach. So we have perfectionism of service, individual approach, concentrating on mental well-being and not just physical well-being. For instance, if we want to cure cellulite, it is not enough just to massage the sick part of the skin, but you should at the same time make your client to feel himself healthy and happy and relax and with excellent mental well-being.
Interesting approach. And what did you do also? How to make people feel happier during lockup and all this pandemic's bad situation?
People who got their Eric's nature felt themselves much more happy than the other one. So Eric's nature or prescribing a great outdoors is one of the great tools to survive in the time of depression, and we have to be conscious that depression is the second disease of the contemporary world, and that just less than 10% go to psychiatrists or psychologists, and the great amount come to see their beauticians or fitness coach or well-being therapist. So we have to look in the eye of our patient. If we see the sorrow, we have to do something. We have to touch our patient. We have to let him smell something nice. We have to let him listen something nice, and if you more listening to the river, to the creek, to the birds, to look at the butterfly and the sunset and sunrise, you will feel better, you will be more creative, you will invigorate, and that is our main task.
So do you think is it helpful to just listen sounds of nature online if you are not able to go out?
It is better than doing nothing.
Yeah, so after lockup, do you go to woods in Serbia?
Yes, Medical Spa Association of Serbia and the Forest Therapy Southeastern Europe, there are organizations that take part in several festivals, and one of celebration was International Forest Therapy Day on 12th of September. So I would like to share with the audience what happened there. There were 38 of us from different parts of Serbia, different ages, different occupation, and what connected us was the nature of Šumadija, that means land of forests, and very, very old oak that they think that the people who lived with Columbus put the seeds of that oak.
So how old is the oak?
We first think that it is more than 600 years, but we find some documents that it is almost 800 years old.
So what did you do in the woods of Šumadija?
We made some kind of forest wellness program. We started with the welcome party, and after welcome party and introducing ourselves, we made the measuring of mental well-being using our tools like Manchester color wheel, mandala-like drawing, using art from nature method, and fulfilling short Warwick Edinburgh mental well-being scales with 7 questions in that test.
And then you went to the woods?
Then we went to the forest, and we were using the method of forest therapy walk created by Association of Forest and Nature Therapy in California. So we first take part in pleasure of the presence to sharpen our senses. After that, we made some invitation called "What's in Motion," trying to put our attention on the micro world, to go more down to the earth and follow what was moving there. And after that, we have an invitation called Bibliotherapy with Haiku Poetry. Every participant got his verse of haiku, and had to share that haiku with the surrounding trees, and listen what will their tree answer as a new haiku poetry. With all of those verses, we made the Tanaka poem, and that is Tanaka from forest from mountain Treska near Bakrač, and Bakrač is a waterfall with a stone jacuzzi, and there is a fairy tale that or legend that some kind of very famous Serbian writer wash his body in that jacuzzi while fairy Raviola was looking at him and his beautiful horse Sharac.
Oh, beautiful. And so, did you measure the scale of happiness after the event?
We performed also final closing tea ceremony, very carefully designed beside the waterfall. And then we have our toast to the nature and to oral legends in Mountain Tresca, and after that we tried to tell to all between us what is the thing that we are grateful for.
Gratefulness is very important.
And after that we go to the field and we enjoyed at the other part of our forest therapy walk, and it was something called idleness or Nixon or Musse. We just lay down to the grass and enjoyed in Koshi music.
So it means doing nothing.
Doing nothing, enjoying doing nothing, and according to the most famous tourism scientist, it is the highest level of luxury, doing nothing. There is nothing more luxury than doing nothing, idleness, or in Serbian we can tell it like blejanje, following the sheep and their calmness and rest and relaxedness.
So this was the end of the event.
This was the end of the event, and after that we go to the sacral place near the forest and the field to get our meal. It was beans in special. Made on special way, and after that we fulfill our second test of mental well-being with mandala like drawing, with Manchester color wheel, and short Warwick Edinburgh mental well-being scale.
And what were the results?
The results, our working hypothesis was that being in the nature should significantly improve mental well-being, and our hypothesis became true.
It was true.
Yes.
Of course. Did you document somehow this event?
Oh, we made from. Oh, there is also something very interesting. What we discovered was real creativity improvement, because we find some kind of item, gala. It is acorn infected by some worm, and when worm infected acorn, it became like a shelter for the worm.
Sorry, how does it look like?
It looks like
ball,
like a ball with the spines, it calls gala. Its name is gala, and we perform gala massage because every participant has who touches gala started to rub gala, to massage hand with the hand in gala in between. So we discovered gala massage. Whenever we have oak, we can perform gala massage, and it is very, very pleasure.
It must be very nice feeling.
Yes. So we documented it in our video performed by Bojana, by you.
I did. Unfortunately, I was not at this event. I was not present, but I just helped you to make this video clip. You can find it on YouTube.
And also we performed something very nice that Bojana was performing at the beginning of our well-being path. It is ethno fitness or Wulala fitness, performing Pilates exercise on woven carpet with ethno motifs.
Yeah, it's interesting to use our ethno motifs with Pilates or yoga or whatever. It's very relaxing to stretch in nature.
Yes, and it is a part of Wulala wellness when you can swim or bath yourself in the wool, and it is also part of idleness, of Nixon, of Musse, of doing nothing and following the path of the sheep.
So, what would you like to conclude? What would you like to recommend to our audience?
What was strange to me, we were thinking that our participants will be boring with testing, but they were really enjoying in drawing mandala workshop. They were enjoying, they were concentrated, they were devoting. So what we discovered that our measuring tools or tools for individual approach are amusing. So
because you didn't use boring tests.
Yes, because it was like a game, and what we discovered, it is a game for all adult people, and it is also a game for kids, because we have a lot of kids.
It's colorful and it's creative.
Yes, and it is funny.
Of course. Thank you very much.
Thank you.